One of the things that will sometimes initiate the onset of labor is having your bag of water break, okay? It's also referred to in very medical terms as ruptured membranes. What this means is that your baby is surrounded completely by a bag of water, the amniotic sac, okay? It's a membrane that contains the baby and the fluid. And sometimes before labor starts or during labor is when you will see this bag break and the water gush out, okay? Sometimes that happens before you ever go into labor. Like for me, it was the initiation of the first thing that happened. My water broke and then my contractions started. And for other people, you know, your doctor may have to what we call artificially rupture your membranes when you're actually in labor. That means they'll do it for you, okay? Either way, it can be pretty messy when it does happen. Big suggestions I would make for you, okay? Once you get into that last month in labor, I would start coating the things that you sit on or sleep on with plastic so that in case it does happen, you don't destroy it. For example, in your car on your nice leather seats, I might want to put some kind of plastic down just in case your water happens to break on the upholstery or on the leather. You don't destroy your seat. And also on your beautiful mattresses at home, I actually put some kind of a plastic bag down underneath my sheet so that if my water was to break at night, it wouldn't go into the mattress, okay? Two really good tips, and I've had clients who said, oh my God, I destroyed my car. So make sure that you do that, okay? Now, if your water does break, and I have to tell you, you hear these stories and all these myths about like, I was in ShopRite and my water just broke in the middle of the aisle, and I know it's like the biggest fear of everybody out there, that my water's gonna break in the middle of the mall and I'm gonna be totally embarrassed. I could tell you, it's a really, really small percentage of people that ever happens to, ever, okay? So just try to let that go, because most people either break their water on the toilet where it's much easier, or when they're in labor in the hospital, okay? What you want to make sure of when you do break your water is that you check the color of it. There's a few things your doctor or your midwife's going to ask you when you call them, and you are going to call them as soon as your water breaks. That doesn't mean you're going to have to rush to the hospital, and in fact, you know, you can stay like that for quite a while. But a few things that you want to know. First, you want to take notice of the color. Make sure that it's clear, that it's not brown stained or green stained, okay? That could indicate that the baby had a bowel movement inside. You would definitely want to tell your practitioner about that. The color, there shouldn't be a bad odor to it, okay? Sometimes it can actually have a little bit of tinged blood to it. That's actually just a sign that the cervix is starting to dilate a little, and actually a good sign that you may be progressing in labor. But any kind of copious amounts of blood or heavy bleeding, you want to be reporting to the doctor or the midwife right away, okay? As far as what you can do once your water breaks, pretty much everything you could do before, except I probably wouldn't sit in a bathtub at that point at home. And you want to do as few internal exams as possible. Remember, that bag of water is what prevents bacteria from entering into the baby. And so now, if you were to do too many internal exams or anything goes into the vagina, you run the risk of increasing your risk of infection. So you could get an infection easier. You know, you want to limit those exams, and you want to try to stay as active as possible. Keep walking around, keep moving around, and get your contractions going.